Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started.
Electricity starts in the SA node and travels through the atria. This produces the first wave in a cardiac cycle, and it's called the P wave. Then it makes its way to the AV node, which holds it long enough for those atria to contract and push that blood down into the ventricles. Then it continues on down into the ventricles, and that produces what we call the QRS complex. And then at that point, the heart resets and gets ready for the next round, and that's called the T wave.
To identify rhythms, it is an absolute must that we measure the amount of time it takes electricity to get through certain parts of the heart. So let's get rid of this guy so we have some room to work. Now, the first thing we want to measure is the PRI. The PRI is the segment of time from the very beginning of the P wave to the very beginning of the QRS, and it should be less than 0.20 seconds. The other thing we want to measure is the QRS complex. This is from the beginning of the QRS complex to the end of the QRS complex, and it should be less than 0.12 seconds. Now, how do we measure time? Well, we use the EKG paper. 5 of these large blocks equal 1 second. So if 5 of those fit into 1 second, one individual block equals 0.20 seconds. Now, you'll notice inside that larger block are 5 smaller blocks. Each of those 5 smaller blocks is worth 0.04 seconds. So now let's carry this over to our PRI and our QRS. Our QRS needs to be less than 0.12. Well, if each small block is 0.04, that means we need less than 3 small blocks. So we carry it over there, and looky there. The QRS complex is less than 3 small blocks. That's what we call a narrow or normal complex. The other unit is the PRI. It's obviously 5 small blocks, which in this case, the PRI is less than 5 small blocks. So both of those would be considered normal. So quick recap, we understand what the P wave is. It's electricity that starts in the SA node that travels through the atria. The PRI, or that flat segment after the P wave, is where that AV node is holding that electricity, and the QRS complex is the electricity traveling through the ventricles.
And that's it for this episode of ECGs Made Easy. Now, to catch our other episodes, go ahead and click right here, and I'll see you over there.